some breaking news now on the Zika virus. There are now 4 confirmed cases of the virus in Miami-Dade County, bringing the total number of cases in the state to 9. This comes as we learn more about how it's transmitted and why it's spreading so quickly. First, the news out of Dallas County, Texas. The Health and Human Services Department there receiving confirmation from the Centers for Disease Control and Prevention of the first case of sexually transmitted Zika virus. The patient was infected with the virus after having sexual contact with someone who is already ill. Also, the World Health Organization's director says it may be related to El Nino. That may be spreading the virus. The reason behind that, El Nino is causing more rainfall, which then brings out more mosquitoes, some of which carry the Zika virus. The HWO declared the Zika virus a global health emergency yesterday. CBS 4's Ted Scouten shows you what that means for doctors here in South Florida.
So the most important thing is that if you're pregnant, try to avoid going to these areas.
Talks like this are going on at hospitals all over South Florida as staff gets extra training on the Zika virus. It's transmitted by mosquitoes. It's especially crucial now after the World Health Organization declared it a worldwide problem.
The situation meets the conditions for a public health emergency.
Dr. Jorge Perez is head of the neonatal ICU at South Miami Hospital. He explains pregnant women are the biggest concern. There appears to be a link between the Zika virus and birth defects. Now, pregnant women who show up at the hospital will be asked specific questions.
One of the things that we're going to be implementing here at the hospital is making sure that any patient that comes to this hospital is asked about travel history.
Of the 28 countries and territories where the virus has been transmitted, Brazil seems to have the largest outbreak with an estimated 1.5 million cases. Most of those are mild. 80% of the people infected won't show symptoms.
Unlike Ebola, that Ebola actually took your life, this is more or less like flu-like symptoms. They usually last anywhere from 2 days to about a week. They don't require hospitalization. They don't require any treatment at all other than supportive care.
For now, pregnant women are told not to travel to areas where the virus is present, and if they do, they should tell their doctor.
Our heightened concern is solely because of pregnant women. If pregnant women weren't affected in this manner, thereby producing these birth defects, this would not be a global health emergency.
So a couple key things to remember. There is no vaccine and no treatment for the Zika virus. That's why prevention is so important. If you'd like to find out more about it, go to our website, cbsmiami.com. We'll have the latest from the CDC there, and that information changes often. In South Miami, Ted Scouten, CBS 4 News.
Ted, thank you. And look for much more tonight on the CBS Evening News with Scott Pelley. That's at 6:30 after the CBS 4 News at 6.